In an interview with the Ministry of Health last week on Thursday, the spokesperson Emmanuel Anibiona told NTV that they were making efforts to ensure that the health workers who have been serving in the Ebola epicenters in Mubende and Kasanda districts received their 3-month salaries, risk allowances and per diem. This was after 76 frontline workers who had been deployed to the Mubende Ebola treatment unit spoke to the media about their delayed pay.
These are also under payment. We expect all of them to have received their money by close of business tomorrow before the festive season.
They now say the promises have not been fulfilled and are alleging that the ministry has started terminating their contracts without notice.
Most of them, they were stopped from work. So to make the matter worse, they were even chased from the hostel. Some of them actually slept outside.
Also, the accommodation fee at the hotel where they have been staying in Mubende has been doubled.
And in addition to that, it has to come from our salary. Yet we are assured and told that there are some organizations like in World Health Organizations which are responsible for actually paying our accommodation and meals.
Now, the Uganda Medical Association, unhappy with the way the health workers have been treated, has stepped in.
We have people who worked during COVID and they are still demanding money for a full year, for 6 months. So it is a very bad precedent and it is not good for us in Uganda Medical Association to see our colleagues suffering like this.
Dr. Luswata has asked the Health Ministry to prioritize fulfillment of promises made to health workers and not wait for them to protest. He points out that if this is not done, it will be hard for the ministry to convince other health workers to offer support in the event of another disease outbreak.
Today we have Ebola, but we even hear that COVID also wants to come back. You know, these repeated things which are happening on health workers when they don't pay them salaries will chase them away. Next time it will be really a big problem to get people to go and work in during these epidemics.
In the meantime, the association will meet with the workers to strategize on how to get the ministry to make good on its promise.
Where they went is the right place, Minister of Health. If it is not Minister of Health which is supposed to pay, then Minister of Health should know the right person who is supposed to pay these allowances. In any case, the work they did was on behalf of government of Uganda.
In response to these queries, the Ministry of Health has reiterated its commitment to pay and that the process is already underway. Joyce Nakato, NTV Tonight.